last several months, we've been covering the problems customers have been having with the state's largest health insurer, Blue Cross Blue Shield.
And for the first time, the company's CEO sat down with CBS North Carolina's Michael Hyland to talk about what went wrong and how much longer it'll take to fix things.
Well, we certainly didn't anticipate what happening.
The new year began with new problems, a system failure at Blue Cross Blue Shield of North Carolina. It created problems for customers from resolving billing issues to even getting access to health care. CEO Brad Wilson recently sat down with us to talk about why this happened.
We certainly understand the difficulties that it's presented to our customers. We apologize for that.
He says there were backup systems in place, but they weren't good enough. Suddenly, there was a surge in calls from customers.
I tried 4 times, anywhere from an hour to 2 hours, without even getting a live person.
I stayed on hold 20 hours and probably spent another 10 to 15 talking.
CBS North Carolina obtained nearly 1,000 pages worth of emails from the State Department of Insurance as the crisis unfolded. They show state employees trained to deal with these problems found some of the responses from Blue Cross Blue Shield very frustrating and confusing. For example, some customers received an incorrect number to call to resolve their billing issues.
Did you all not grasp the scope of how significant the problem was? When did you start to get a grasp on what exactly it was you were dealing with?
I would say that we had we certainly didn't anticipate and understand the avalanche, again is the term that I would use, right at the outset.
The Department of Insurance has extra staff trying to help customers. Blue Cross Blue Shield also recently trained 80 more people to handle calls. But some customers are still having trouble.
I've talked to some who 2 months later still didn't have their issues resolved. Are they owed anything more than an apology? Should they perhaps be getting refunds, any credits to their bills, something of that sort?
Well, any customer who has suffered any financial loss, we have and will continue to make whole. An apology, I know, doesn't make them feel a whole lot better if they were inconvenienced as a result of having a missed appointment or didn't get a prescription filled timely. What is appropriate for us to do is to make sure and intervene on their behalf to get them that appointment again or make sure that prescription can be filled.
Wilson says it should be a matter of weeks before things return to normal.
Our response could have been faster. We wished it had been, but I can tell you it wasn't for the lack of trying.
And the company is under investigation by the state. Executives are also considering getting out of the Affordable Care Act marketplace, potentially impacting customers across the state. We'll hear more of Michael's interview with Brad Wilson tonight at 11.